Good afternoon, and thank you again for joining our Policy Committee call on homelessness. I'm going to turn the committee call over to Michelle Feldman.
Hi, everyone. Thanks so much for joining us today on today's Policy Committee call around homelessness policy. I'm going to start off by turning things over to our Policy Committee Chair, Peter Kaplan.
Good afternoon, everyone, and welcome to this Housing Alliance Policy Subcommittee call on homelessness. We are delighted that so many of you, over 100 people from cities, suburbs, and rural areas located all over the state, have registered to join us for this call. Next, you're ahead of me. Next slide. I'm Peter Kaplan. I'm the chair of the Policy Committee of the Housing Alliance of Pennsylvania. And as you can see from this agenda slide, this call will have one presentation by Michelle Feldman, the Policy Director of the Housing Alliance, followed by a question and answer period led by our two guest experts, Adrienne Walnoha of Social Artistry and Leigh Howard of Diana T. Myers & Associates. I'd like to take a moment to provide you with a little background on the Housing Alliance of Pennsylvania and to introduce our speakers. Next slide, please. The Housing Alliance is a statewide coalition working to provide leadership and a common voice for policies, practices, and resources to ensure that all Pennsylvanians, especially those with low incomes, have access to safe, decent, and affordable homes. We promote common sense solutions to balance Pennsylvania's housing market and to increase the supply of safe, decent homes for low-income people. We're a diverse coalition that includes nonprofit and for-profit housing developers, people with lived experience of housing issues, service providers, government, and funders. Next slide, please. We seek to be Pennsylvania's go-to resource for building knowledge and skills by providing research and information services, education, training, and technical assistance, and outreach. Next slide, please. The Policy Committee's role in this work is to produce information and policy recommendations that inform and shape the activities and policies of the Housing Alliance. We have 4 policy subcommittees reflecting 4 core issues: homelessness, blight, homeownership, and affordable rental housing. In addition to the homelessness subcommittee meeting today, we held a meeting of the homeownership subcommittee on January 25th. We also held a blight subcommittee meeting last September and presented our blight policy and practice agenda as part of our new report, Revitalizing Pennsylvania, at last October's Homes Within Reach conference. Now it's my pleasure to introduce our 3 speakers today, Michelle Feldman, Adrienne Walnoha, and Leigh Howard. Michelle Feldman is the Policy Director of the Housing Alliance. Michelle brings to the Alliance a background in community development, media, and advocacy. She previously served as the Executive Director of Keep Philadelphia Beautiful and as the Commercial Corridor Manager and Communications Director of the Frankfurt Community Development Corporation in Philadelphia. Prior to entering the world of housing and community development, she worked for 2 political consulting firms specializing in media. Adrienne Walnoha is the principal consultant of Pittsburgh-based Social Artistry. She is using her decades of experience in social service provision and management to help local human service providers develop and sustain the highest quality basic needs services, including food, housing, and both physical and mental health care. Adrienne served as the CEO of Community Human Services, CHS, from 2005 to 2018. Under her leadership, CHS expanded its housing assistance programs to include atypical shelter, housing first, eviction prevention, and rapid rehousing programs, which had previously not been available in Allegheny County. Leigh Howard is the CEO of the Philadelphia-based Diana T. Myers & Associates, or DMA. The mission of DMA is to provide affordable, accessible housing for low-income families and individuals, especially those who are elderly, homeless, have disabilities, and/or special housing needs. Since joining DMA in 2006, Leigh's work has centered around the housing needs of special populations, including families, youth, and adults experiencing homelessness, individuals with justice involvement, individuals living in nursing homes and personal care boarding homes, and persons with serious mental illness and/or substance use disorders. During this time, Leigh is focused on using research and data to determine the housing needs of vulnerable populations, and this research has informed her practice. I'll now turn the meeting back over to Michelle.
Thanks so much, Peter, and thanks to everyone for joining today's call, as well as to Leigh and Adrienne for helping to lead our discussion today. Before I turn the call over to Leigh and Adrienne, I wanted to take a few minutes to cover a couple of topics. As you may remember, we recently surveyed our membership about homelessness policy to hear directly from our on-the-ground partners like you about barriers and challenges, but also about solutions and ideas that we might look to elevate and amplify at the state level. We had close to 80 responses covering 50 of Pennsylvania's 67 counties, and a few key themes and patterns emerged. First and foremost, the impact of the opioid crisis and the need for increased resources for mental health and drug and alcohol services is clear throughout the state. We specifically asked how the population served by respondents has changed over the last several years, and more than half of our responses spoke to the opioid epidemic. We also heard that, primarily, local continuum of care priorities reflect local services. And on the ground, the national shift to housing first has impacted local efforts, with most indicating this to be a positive change. All of that being said, most of our respondents indicated that funding, policy, and service priorities don't currently reflect and aren't currently responsive to local needs, something we're eager to hear more about during the discussion portion of today's call. We also wanted to know what sectors and systems would be most important and impactful to better coordinate with your work. Again, healthcare, including mental and behavioral health care and drug and alcohol treatment, rose to the top, as did the criminal justice system. Many also noted that partnerships with health institutions and entities proved particularly effective. We also asked about the gaps in programming and services that created the biggest barriers to serving those experiencing homelessness. We heard loud and clear that funding for brick and mortar and landlord engagement represent large challenges. To that end, many of our respondents offered reuse of abandoned buildings as a solution, which connects with another of the Housing Alliance's priorities that Peter just spoke about, tackling blight throughout the Commonwealth. We also asked one of our favorite questions. If you suddenly had $1 million in unrestricted funding, what would you use it towards? Most of our respondents answered they would use new funding to fill capital needs, rehabbing units and creating new units, as well as services such as case management. Before we begin the discussion portion of today's call, I wanted to mention two policy priorities related to homelessness that we're currently working on. One is to increase funding for the State's Housing Trust Fund, or FAIR. FAIR is a flexible funding source that can be used for a variety of affordable housing purposes, including homelessness prevention services such as rental and utility assistance and foreclosure prevention. If you're interested in working with us on that, we want to hear from you, and my contact information will be on the last slide of this webinar. We're also working to advocate to the state to apply to the federal government for a waiver to Medicaid that would allow Medicaid funds to be used for the service component of permanent supportive housing. And with that, I want to turn the call over to Leigh and Adrienne so that we can dig deeper into the survey results. And Leigh, I'm going to turn it over to you to get started and switch us over to our question and answer slide. And I did want to note that while all lines are currently muted, to respond to these questions, and it's at the very end of the slide, you can press *7 to unmute your line and *6 to remute your line. And with that, I'm going to turn it back over to Leigh.
Thank you. Hi, good afternoon, everyone. I'm Leigh Howard, as Michelle just stated, and we're hoping to hear from many of you today on today's call. The first question we're going to get started with is, do the survey results that Michelle just reviewed reflect your experience of barriers to serving the population experiencing homelessness in your community? So, Michelle, can you say one more time what the number was to unmute?
Absolutely. So it is *7 to unmute your line.
I'll just say one thing if nobody else is going to jump in. Often I ask folks about if they're seeing folks experiencing opioid addiction in their communities, and I often feel like I get just vastly different answers. I either hear from folks saying, no, we don't ever have those folks in our programs, or some horror story about somebody who recently overdosed and was discovered by program staff, etc. So the fact that there was such prevalence in the responses in that I found to be really interesting. I don't know if somebody else can speak to that, or any of the other survey results that were reviewed.
This is Laura Gleason with Volunteers of America, the Supportive Services for Veteran Families program. Leigh, I would agree with you. There are some counties in which, or some maybe communities in which there's just a belief that, well, that doesn't happen here. But I would say that that's just kind of a looking through, rose-colored glasses in that community, because the statistics don't support a community saying they don't have it.
Right. Or it speaks to the fact that for whatever reason those folks are not making it to these programs that are offering housing or homeless assistance.
This is Janine Miller in Philadelphia. Can you hear me?
Yes.
Great. I had myself double muted. I would say the one thing when I look at the survey results, I think about one thing that impacts us here at Project Home is thinking about people's access to income. And so one of the things that we're really concerned about, and I'd love to hear if other people are as well, is thinking about, especially with GA, the General Assistance Program coming back, and people who are the most disabled having access to some small amounts of income to support them. I wonder if that's an issue for other people as well. We're facing some elimination of that program again, and so we're really concerned about that as a priority to help keep people stabilized in their housing, because people often use that money to rent a room, or in our case, if there are renters, they pay 30% of it to pay rent. So that's something that we're looking at too in terms of stabilizing people in their housing.
Are folks in other communities talking about that issue as well?
This is Jennifer from Mental Health Partnerships, and we absolutely are talking about that issue because a lot of our constituents and a lot of our participants utilize general assistance.
Great. Any other comments regarding the survey results? Any other barriers that you felt were significant in your community that were not reflected in the survey results? Oh, that's the next question. You're going to ask that.
Pardon me?
I'm sorry, Adrienne.
This is Laura again. I think one of the issues that we have for our population and the counties that we serve is that while the county itself has, a couple major hubs and towns, there are so many far outreaches that we do have a good number of individuals who just have absolutely no ability to have general or frequent transportation to the services that they need. That's something that we deal with our veterans very frequently.
Makes sense.
And that did come up a couple of times in the survey results as well, the link to transportation. So thank you for mentioning that.
Adrienne, I'm clearly going to turn it over over to you now, since I am sneaking in on your question there.
Oh, I know. It's challenging when we're working with a group that has all these intersecting points. So can folks hear me?
Yes.
Great. This is actually a really exciting conversation that we're having this morning. I do agree that we have a lot of, as homeless providers, a lot of unique experience because the folks that we're serving have touched multiple systems. And so the service connections, the service intersects, the way that problems can somehow overlap and levels of complexity, I think is one of the things that's more unique to the homeless system and certainly creates a lot of challenges for us. So one of the things that I'm particularly interested in and certainly came out in the survey is what are the more core barriers that are particularly making it difficult for us to address people's needs quickly, make sure that the services are in place to keep them stabilized, and to ensure that folks don't have to come back into our system. So I'm curious for folks on the phone, what types of barriers or facilitators are you seeing related to making homelessness rare, brief, and non-recurring, in addition to items that have already been discussed?
It's Laura again. One of the things that I would say that we're finding as a barrier in general is that people don't know about 211. And it's required for so many counties and COCs that individuals start with the 211 call, and the greater public doesn't know about it.
So what types of strategies have you used in your community to get the word out and to get saturation about knowing 211 is a resource? Have you had any success there?
Honestly,
yeah.
I can't say that I've really participated in that brainstorming. I can just bring it up as a problem. I work solely with veterans, and so much of the veteran communication is between themselves. We're making sure that other veteran service providers know about it, VFWs, American Legions, all places like those, so that hopefully the word spreads amongst that particular community.
So I think you also touched on another issue, which is the communication can sometimes be more difficult in communities that are not as densely populated or may not have as many service partners. Is that something that folks are seeing and experiencing?
Hi, I'm Gwen Brown with State Rep Isabella Fitzgerald's office. And
hello, Gwen.
Hi. I guess for part one of the statement you're making, the communication, how do we as the state office, get information, like you said, how do we get it out? We don't have a lot of correspondence or other than telling them about 211, but are there programs that we can get information from that we can post in our office or send out on our emails as an ongoing thing to communicate with the constituents in our area? Because communication, I think, is a big barrier for us. A lot of people, like you said, don't know that 211 exists. They know about 311. We give that information out pretty frequently for things going on in a community, like trash and stuff. But for this type of situation, we don't have a lot of correspondence or like places we can contact to give us information so we can put it out there.
Well, one recommendation I can make is the Housing Alliance of Pennsylvania. Is a great partner to help us understand what the larger trends and information sources are.
Okay.
Do others have other suggestions that have been really helpful on their end for data gathering and resource collection?
Yeah, because I'm kind of new to this, getting in on the calls and being a part of the alliance. So I just wanted to bring something back to the to our office, but that was good. That I can contact the Housing Alliance to get that.
Yeah, and my contact information will be on the last slide. So you can always send me an email or give me a call, and I would love to hear from you directly.
Great. Thank you.
Sure.
Are there other barriers folks are looking at in their communities that are keeping you from being able to find folks, place folks, keep folks safe, and keep them permanently out of a homeless situation? We did see a lot of comments from participants, but is there something that's really rising to the top in your community? I know in Allegheny County, one of the big barriers for us is just the lack of affordable housing stock.
Yeah, I would say that applies to us in Adams and Franklin County as well. I'm sure that's a global issue.
Hi, this is Gail with the Housing Alliance out in Pittsburgh. Can you hear me?
Yes.
Yep. Oh, good. So I think in conversations that I have with folks in many communities, not only the lack of affordable housing seems to be a real challenge, but oftentimes the quality of the housing. That, providers often say to me, they're not going to put somebody in a home that they themselves wouldn't live in. And there's a real struggle to find, when you do find it affordable, it's not quality.
That's a great point, Gail, and one of the issues that is a little harder to get your arms around because it typically involves private landlords. Are there other items that folks on the call would like to share related to barriers to housing folks, keeping them housed, and keeping them out of the system in the future? If not, we'd love to dive a little deeper, and I can turn the conversation over to Leigh.
Great. Next question we just want to talk about is what education topics are most needed in your community. Things that I often hear are additional training needs around access to housing, whether it's obtaining housing through private landlords or the housing authority or something like that, how to better assist clients in maintaining housing, working with a wide range of housing providers or even providers in other systems, whether it be healthcare or the mental health system or other social services. But those are just sort of a sample of some that immediately come to mind. I know that through the conference and the webinars that the Housing Alliance often puts together, this kind of information would be really helpful to inform needs.
Hi, this is Megan from Adams and Franklin County. Can you hear me?
Mm-hmm.
Okay. So I think some of the stuff on motivational interviewing and I think diversion, both of those would be really important. I think there are definitely strategies we're trying to implement fully in our communities.
So
this is Elisa from Northampton County, and one of the things I think we keep talking about here is how do we use data more effectively to really examine, what our needs are and what our inventory is, and really kind of using that to match gaps with funding, not just on an individual agency basis, but kind of within our advisory board.
Great question.
Yeah, I would second that as well. I know that we're looking at a lot of our data to identify what we're doing well and what we're, the kind of acuity issues that we're really lacking in. So I think helping us to better understand data and then look for solutions when we find some of the issues where we might not be doing as well.
Great. So both on a community level, or even, at least in your case, a regional level, as well as program level.
Yes.
Does anybody on the phone have, in your community, are you using data effectively? Is it available on program level as well as a community level? Any sort of practices or resources that you can speak to about that?
This is Megan, again, from Adams and Franklin County, and we're using our HMIS data as well as we do a client tracking system for CSVG, because the race and ethnicity we don't have that data in our HMIS data the same way. And so we've been pulling all of that together along with the acuity of the individuals, again, and looking at who was successful, who left unsuccessfully, who voluntarily left, so we could identify where our gaps and issues are, and that's been really helpful. It also, because we had included the ethnicity and race issues, we did find what we perceive maybe a little bit of unconscious bias taking place in one of our shelters, which has been really helpful as well.
Wow, that's great. I would love to follow up with you offline about that, by the way.
Okay, that'd be great.
Any other education needs? We've had motivational interviewing, diversion, use of data. I know there's been a lot of attention over the last couple of years to the idea of billing Medicaid for housing support services. I don't know if folks on the call are doing that, or if that's something that you're still trying to crack, if additional support and training is needed around that specifically. I know I get a lot of questions about that.
We would be interested in that, yes.
Great. All right, Adrienne, I'll turn it back over to you.
Great, thank you. Directly connected to training and education topics and data is the climate changes that we are consistently facing as providers. We have funding changes, we have protocol changes, we have new groups of folks emerging using our services. We may see different age cohorts, more medical complexity. Certainly I've talked about the opioid epidemic, enhanced mental health needs. So one of the things that we would love to talk about and share successes and best practices around is how are we as organizations responding to our need to do more to address these shifts that we're facing. So are there folks on the call that have strategies related to funding, training, new service offerings that they're using to meet this changing environment that we're living in?
This is Megan from Adams and Franklin again, and sorry. This probably ties into training that we were just talking about. You know, the shift in funding has impacted us, our shelters, pretty significantly. In one county, I believe we'll have to close a shelter. So figuring out how we transition from being a shelter provider to being a county where there's no shelter but still continuing to provide good services to homeless folks. And I'm sure there are others who are experiencing this. So I would imagine that this is probably something that we could use some expertise on.
That is so unfortunate and so helpful. Are there others on the call who are really drastically shifting their programming related to either changes in the folks that we serve or changes in funding or expectations?
This is Janine Miller at Project Home in Philadelphia. We've seen definitely trends in our own organization and around the city around the having enough staff to support people. And we've had some long-time dreams around getting Medicaid to pay for more housing services that will help people stabilize in their housing, and that feels like an under-tapped resource that we know we'd like to make some progress on, but because of some of the political climate, it's been harder to do. So it sounds like a lot of people are having struggles with the kind of staffing and supports needed to keep people housed.
Absolutely, and it also seems that folks are having trouble tapping into the funds that may be available to support those types of services. So would individuals and groups on the phone agree that one of the training components that may be valuable across the board is a greater understanding of funds that may be available for how to support services and how one goes about applying for those services and executing on those services?
Definitely.
Yes.
Mm-hmm.
Yeah, I think that combined with advocacy training to get more funding.
I think that everyone on the call would agree that we could use more.
Yes, I think emphatically so.
And tied to that, I'm curious to the thoughts of folks on the call. Are you seeing more complex users of services? I know one of the things that I have really struggled with in the last few years is the level of complexity we're seeing in the folks we're serving. Medical, behavioral health, drug and alcohol, histories of trauma, and being able to wrap around those folks in a way that is appropriate and meets their needs. Are other organizations seeing more complex users in their services?
Yeah.
Yes.
And also, this is Gwen Brown with State Rep Fitzgerald's office. A lot of the people that come into our office looking for help because they're homeless, they're sometimes incoherent. We can't get a lot of information out there, but the one thing that they emphatically do is refuse shelters. Somehow they say, I don't know if this has to do with what we're talking about today, but just to give you some input about those complex personalities coming into our office to get services, that's what we're seeing. And they don't want to go to the shelters because they think they're unsafe. And that safety issue is a big issue with the constituents in our area.
I am so glad you brought up that point. Not only have I heard from folks concerns about their safety with using programming, but I've also heard from staff concerns about their safety in this changing environment. Are others on the call experiencing these concerns about safety?
Yes.
Is anyone utilizing new and exciting models to enhance their ability to provide safe spaces? Are we using new technologies or rethinking our physical plant or training our staff in different ways?
We definitely are trying to get different training for our staff. It's not always available.
Do you typically have financial resources to recruit trainers or get training at your organization, or is that also a barrier?
Yeah, that's also a barrier. I mean, we're talking to our, drug and alcohol at the county level to see if they can come and bring some of their CRSs to help us with those pieces. But yeah, globally, we really are just trying to keep shelters open. So you've reduced staffing to a place where it's tough, and then you have higher acuity folks. So yeah, we could definitely use training.
So we definitely have that perfect storm.
We do. With a high desire to do it right. You know what I mean? People are not giving up, but it's just
Sure.
I feel like from an administrative perspective, I'm putting staff in places where they don't have the skill set, and it'd be different if I could hire folks that might have the skill set. But I mean, many of my shelter folks are making $11 an hour, and it's a perfect storm.
Well, this actually leads into Leigh's next question, which really starts to tap into that. What more could we be doing from a resource development perspective? So I will hand over to Leigh.
Sure. Are there current funding streams that could be made more flexible to address local needs? And the example that's shown here is, for example, funding streams for emergency shelters. And I guess I would expand that to say that would include perhaps operations dollars. It sounds like it could also include service dollars. Obviously, emergency shelter is not the only source worth considering and discussing today, but I know that was a theme or a thread within the results of the surveys that were completed.
This is Janine from Project Home. I was just thinking about what folks were just saying around the kind of safety questions, and also to what you were just saying, Leigh, around kind of resources. I'm not the one here doing this, but I was just, Project Home got a SAMHSA grant for technical assistance, and we've been able to use some of that money to send staff to get this de-escalation certification, where it kind of trains staff on how to train other staff around de-escalation. And so we're trying to bring in some of those same concerns around safety, but also safety for everybody. So being able to treat everybody with the dignity and respect that they need by having these kind of trainings. And the training is called CPI training, which I'm embarrassed to say I don't actually remember what CPI stands for, but it is around de-escalation. So we've used SAMHSA technical assistance money to pay for staff to go get that training.
Huh. And the staff are staff for shelters or any type of homeless assistance program?
We have staff that are attending the way that we have a director who's supporting our permanent housing that's going, and then we have also somebody who's going that works at a engagement drop-in center that we run. So it's actually for the whole gamut, and our idea is that lots of staff would then be trained by our staff that are becoming trainers.
Great.
And I think finding ways that counties could join together, or regions or RABs so that they could apply for some of those funding. I think some counties like ours are very small. So it probably would be a little bit difficult for us to get it, but if we did it as a regional approach and could get some train the trainers, we could probably do the capacity building pretty good.
That's a great idea. Does that, I know we don't know a significant portion, but hopefully folks have heard of de-escalation techniques and strategies before. Does something like that sound like it potentially could be responsive to the issues that were just being addressed regarding safety concerns and an increase of very complex, high-need individuals that you're seeing in your program?
Yes.
What else? What other funding streams or needs should be really re-examined and further discussed to add some flexibility to be responsive to your local needs?
I would think in counties that have the Human Services Block Grant, the way that HAP is utilized can probably be modified somewhat to be able to augment this. I mean, I know a lot of counties don't have that, but at least there's some flexibility. Even educating commissioners on the different purposes for HAP in our community where I believe our shelter will close, almost all of the HAP money is going to a domestic violence shelter, not saying that it shouldn't go there. But like there's no rental assistance at all in that county, which makes it difficult because, we certainly feel like that leads to some of the evictions that we have when people hit a barrier. And homeless prevention dollars are just simply too low. 30% of the median income for a family of 5 is less than the poverty level. So it makes it hard to use those funds. So, maybe repurposing HAP a little bit and figuring out how we can use homeless prevention to fill some of those gaps might be beneficial.
Great.
So this is Elisa again from Northampton County. And so it might be helpful to even have sort of a spreadsheet of the various funding streams that are available and what the priorities are so that communities can begin to look at, are we using these effectively as a whole for the community? Because again, I feel like I know what my agency gets. Right. I don't necessarily know what other agencies are getting, and I don't know the full gamut of what I'm missing in my sort of arsenal of potential funding streams. And so maybe it's not just about what could be more flexible, but do we have the right coverage? Do we have the right spread of resources that are available to us?
Right. Yeah, I would agree with you.
That makes sense. And can you reprogram those funds to be responsive to where you have gaps? If you're using one source for in a way that could be funded through a different source, freeing up those dollars to be responsive to those gaps that you've identified.
Right. And if you're finding multiple under-resourced communities, because sometimes funding just doesn't come to some communities, can they apply for funding together to try and meet some of those needs? Or they might be just too small on their own.
Great. I think for the sake of time, unless somebody has something to add, I'll send it back to Adrienne.
I have to say this discussion is really, it's just got my mind moving in a million different directions. And that leads beautifully into the partnership models. One of the things that was just brought up was that joint funding for training, which I always think is incredibly smart use of our limited resources. It also started me thinking about, are there ways that we could tap our local expertise and share across communities using a vehicle like the Housing Alliance, being able to bring models that we've used, trainings that we've done, and really enhance that capacity, even if that's in an online way. So I started thinking immediately about all these partnership models. So I'd love to hear more about what folks on the phone are doing, what they're thinking about doing with partners, what they think might be that low-hanging fruit or creative ways that we could not only enhance our ability to provide good services, but also to increase the amount of housing we have available.
I think making sure to share, Carlisle just had training on rapid rehousing, diversion, and shelters, and we aren't in Cumberland County, but we found out about it, and I took a bunch of my staff because it was affordable. So I think the more we can make sure that people know about trainings that are happening and across the state, that helps. We also are partnering again with drug and alcohol in our community. Although they canceled the training because they're not sure, they're trying to get some extra expertise because they're not sure that they have the information that will be the most helpful for us. But we certainly are looking for any of those resources that exist.
That's fantastic. Anyone on the call doing unique partnerships that are helping us actually get more units on the ground or the development of bricks and mortar? Anything we're engage with landlords or local developers that might be something for others across the state to think about?
This may or may not be what you're thinking of, but in Adams County, because affordable housing has been such a huge concern, the health system actually identified it as a top 3 issue, as did the Community Foundation. And so they've given some funding to hire a staff person to coordinate efforts to try and bring the community together to do affordable housing. And because Gettysburg College, Harrisburg Area Community College, and the health system were able to bring in Matthew Desmond to start to kick off that event. So it's non-traditional partners that are being impacted by housing who are bringing some legitimacy to the issue that social services is not able to bring. And we're hoping that that will translate into more affordable housing units.
That's wonderful. I know Pittsburgh is definitely seeing a lot more partnership opportunities with local hospital systems.
Yeah, it definitely raised it to a different level in the community when the health system said this is a top issue.
Have others been able to get unusual or unique partners to carry your torch forward? Places like hospital systems or even private development companies, philanthropy. Is anyone getting traction with those types of partners?
So in the Lehigh Valley, particularly in Easton, the mayor has actually been working with some developers trying to use some brownfield sites to redevelop for affordable housing, a combination of affordable and market rate housing. And so they're in the process of kind of, they have the property controlled right now, and they're in the process of trying to put together the funding syndicate for it. So, but that's really been driven by the mayor.
Well, I'm starting to see the time, unfortunately, and we have about 7 minutes. So I'm actually going to turn over to Leigh for our last question, and then we'll do some wrap-up and think about next steps.
Great. So I guess I'll call this our what else question. What else? Are there any other resources or policies working in your community that you would like to share today for consideration, or is there anything else sort of pressing that we didn't ask about specifically that you'd like to raise? All right. Well, with that, I'm going to turn things back over to Michelle, and thanks everybody for your input. I think the conversation today was really valuable.
Absolutely.
Thank you.
Yeah. So thanks everyone for your great input today. I've been taking copious notes, and I just want to thank everyone for taking an hour to give your thoughts and your input as we set priorities. And I'm actually going to turn it over to Peter Kaplan to end today's call and talk a little bit about what's next.
Well, thank you, Michelle, and thank you all of you for a great conversation and some really valuable ideas. As Michelle and I mentioned at the beginning of today's session, the main purposes of the call today have been to share the results of our homeless survey and, more importantly, for you to share your ideas about how we can make homeless rare, brief, and non-recurring in our communities. We're going to use the results of the survey and the great discussion that we've had today, and like Michelle, I've also been taking copious notes, and we want to use both the survey and the discussion to inform our legislative agenda for 2019, which we will present in a legislative briefing in March or April. Again, we really thank you for your contributions to this effort and for the work you do every day to end homelessness among our neighbors throughout the Commonwealth. I would also invite you, if you have any thoughts after the call that occur to you after the call that you'd like to share with Michelle and with the Alliance in general, you're more than welcome to send those along. I would, with Michelle being the central point of contact. So again, thank you very much for a great, engaged discussion today.
Thanks, everyone. And we'll send some follow-up information at the beginning of next week as well, including the PowerPoint slides.
Thank you so much.
Have a great afternoon, everyone.
Great. Thank you very much.
Keep up the great work.